worker at the university and dealing with geriatrics and medical social work, but also has been part of a group that have started a private counseling center called Maturity Matters, which is on Stadium. And so certainly dealing with issues of life transitions, some of those difficult issues, caretaking of a loved one with serious illness. So we're really glad to have her this morning talking about some of these difficult conversations that we face either with our own parents, our siblings, or our own children as we age. We will have a time of questions at the end, so please be thinking of things that you would like to have addressed. So with that, I will let Leslie share with us.
Great, thank you, Gail, and thank you everyone for having me. Just want to check my volume. Everything, you can hear me well enough? Okay. I tend to talk loudly because sometimes the folks I see in the hospital don't have their hearing aids in. So I want to make sure people hear me, but you know, if I talk too loud and you do have your hearing aids in, then that's a big problem. So if I get too loud or not loud enough, just holler. Gail, thanks for the introduction. I have been a hospital social worker since 1995. I've worked in several institutions around lower southeastern Michigan, have my master's from Wayne State, and I actually started out in mental health work, inner city mental health, but had an internship at a hospital and decided I really liked hospital work. So for, I think the first 10 years of my career, I did mental health work, but then worked on weekends in emergency rooms and doing discharge planning. In addition to that kind of work, I worked for about 6 years at a place called Henry Ford Village, which is a retirement community. Used to be affiliated with Erickson, which is a big company out east. And I also have taught at the school of social work here for about 7 years, aging courses, and also did a certificate program for them that just ended this past January, or last January, a year's gone by. And it was called an Advanced Clinical Certificate in Dementia. So a lot of my work for the last 13 years is at University of Michigan with the geriatrics inpatient team. So that is a really lovely position. I feel so fortunate to have this job. It was created as a pilot program for 6 months, and right away they discovered how valuable it was to have a social worker there to help navigate very challenging times for patients and their loved ones. And so yes, fast forward 13 years, I'm still there, not going anywhere yet. The brochures you see on the table, you are the first to see them. They are in draft mode, and yes, there are some spelling issues because my daughter has dyslexia. This is one of her first gigs for her portfolio. She's studying graphic design in Chicago. But yeah, she needs a spell checker. But I did, Sarah had asked me to bring those for you. And I'll just speak very briefly on that. Maturity Matters is a company that I created during COVID because we had a very difficult time noticing how many older adults were isolating and very few therapy offices, had openings. Some people were saying, 6 months or longer, even within University of Michigan's health system. So we now have 12 therapists. And I'm not here to advertise that necessarily. I just want you to know it's a resource in the community. If you hear of somebody with chronic health issues or somebody who's struggling with grief or depression, anxiety issues, we do have folks who specialize in working with more mature clients. So, having said that, let's get to the program. So I understand it is maybe called Dealing with Difficult Conversations or something like that. How many of you, show of hands, have already done a durable power of attorney? Okay, so that's good. a fair amount, about half of people. And it's important, I will just say, for those of you who have done it, to keep evaluating that, and if your circumstances change, to make sure that you get an updated document. A lot of times people are concerned about doing them, somehow thinking that just by, filling out these forms, you're, expediting health issues or concerns. But really, it is very, very, very important to have an advocate for anyone over the age of 18. So not just people over 60, but as soon as you are able, to potentially have health issues that could happen suddenly. Unfortunately, a crisis, I've done a lot of emergency room work, so a lot of car accidents or falls off of ladders, et cetera. Accidents by nature are accidents. No one expected them to happen. So being proactive and having your documents in order is an important thing. So good for you, those of you who have done that. But it is really important to have also gone the step further and talked to your family about what your wishes would be and who your advocates are. We have often, I cannot tell you how many times patients will be at the hospital having had a health emergency, and the oldest child will think they are the appointed person, and they walk in and they say, "I'm the oldest, I'm in charge." And we find the document and it's someone else. And there's maybe even a neighbor or a friend, because what you should do when you are identifying your patient advocate, and I'll go over some of these terms in the documents shortly, but you should choose the person who you really think is up for the task. It is very challenging in a health emergency for some family members to be calm and be able to make informed decisions for somebody because the emotions are just so high. So if you have that person in your family, it's okay to choose someone else that you think that the other folks might struggle. In addition, we have a lot of situations at the hospital where the identified patient advocate, the first person, maybe has some cognitive changes. And that creates a real dilemma for medical providers because if we're concerned that the advocate isn't able or has the capacity to act, even though they're on this legal document, what the hospital does in those situations is they apply for a legal guardian. That's the only way we can override a durable power of attorney. And that's a court process that is very messy. Guardianships in Washtenaw County take 4 to 6 weeks to get the initial person. Sometimes we can get an emergency guardianship if there's like a very urgent medical decision that needs to be made, but it is very, very rare that we get those. Usually we get those for folks that we don't have like identification for them or something like that, and they maybe need an amputation. And it's a really big decision, and we need somebody who can be responsible for that. But other than that, we really struggle. So that's just another option that you'd like to avoid. So I'm not going to talk much about guardianships today. What I am going to talk about, though, is something called 5 wishes. Has anyone heard of this? So 5 wishes is you can go to the website, and I don't have enough copies of all of these to print out. And 5 wishes, actually, in order to get the free document, it is free, but you have to sign in and create an account, and then you can access the document. But the first thing, and it's really simple, and it's something we should all do, again, and think through while we're healthy and have capacity to be really thoughtful and problem solve, and again, can share this with our loved ones. But the 5 wishes are pretty simple. I'm just going to read them off. The first one says, the person I want to make care decisions for me when I can't. So who is that? The second is the kind of medical treatment I want or don't want. Okay, so as you sit here now, you might be thinking, I would want everything, always, no matter what. Some of you might be thinking, absolutely not. If I can't have meaningful conversations with my family, if I can't do the things I like to do, I'm not sure I want someone to artificially extend my life. How comfortable I want to be. This is a really important one right now, I'm going to tell you, as a hospital social worker. All the stuff that happened, right, over the last few years with all the addiction issues, with some of the opioid problems we had, we were, for a long time, over-medicating people because we could. The pendulum over here now is we are under-treating pain often, I will tell you this. And so figuring that out with your providers, writing that out in terms of what you want, what risks you're willing to take is going to be really important. And you have the opportunity in this particular document to write it out. How I want people to treat me. I kind of joke with my kids because I have, again, worked in hospitals for really 30 years this year. I'm okay if I become a person who's dependent. I see the value of being in a facility where there are trained staff to take care of me. I would hope I don't need that, but if I need that, I'm okay to go to a place. But I've told my kids, I want you to visit me, hopefully, once in a while. I want lotion every night on my skin. I have a favorite chapstick. I want it on twice a day. I don't like cold water in my shower. I don't like water in my face. And so I see some of you smiling, but these are seriously the types of details you can leave in a document, because if you get impaired at some point, you are no longer able to share those things. Yet it's important to you now. If like I like my shower a very particular temperature, and it's okay to let your kids know what that is, because they don't know how you take your shower probably. So here's a chance, to be able to share that kind of information, how comfortable you want to be. And also if you're okay with medications, if you are starting to have any kind of behavior issue, if you are, agitated or just, having a lot of pain or whatever, how much treatment would you be willing to do? Or are you a person who says, I'll tough out the pain because I want to be able to talk to people till, the very end of my life, and I can tolerate some pain. Some people have a really high pain tolerance. Some people have a really low pain tolerance. So what is your story? And what do you want people to identify and recognize, and how do you want to be treated if you couldn't tell us yourself? And then just, again, what I want my loved ones to know is the fifth wish here. And that's other stuff, right? Those are the things we always think we're going to have time to talk about. Like, I'll do that conversation tomorrow. I'll do that conversation at Christmas, or I'll do that conversation at the family reunion. We never know about tomorrow, right? So anything can happen to us. And so while we're able, it makes a lot of sense to think about getting those things documented, or now there are ways on telephones, to record things and saving that, and even say, you know what, don't read this now, wait till you need to. Although I am a big fan of talking about it ahead of time while you're able. But if that's too uncomfortable, at least get it down somewhere. It's super important. So what these 5 wishes fall into is something we call advanced directives. Okay, so this is an example of that. You don't need this particular document, but again, I said if you are interested in it, it is a free, last I checked, it was free online. You just have to create an account with this 5 Wishes organization. The other thing, if you decide you're going to go this route, is just filling out this document isn't enough. In fact, some states don't recognize this. And in fact, have you ever heard of a living will? Yeah, so Michigan, again, is one of those states where, depending on where you are and who you're talking with, the final sort of formal line on that is that living wills aren't really recognized necessarily. Depends, again, who you talk to. But advanced directives, again, is another example of a living will. Essentially, it's a document that says what I would want, and it includes these kinds of things. In order for a 5 wishes document to be valid in Michigan, it has to also have this form affiliated with it, okay? So it's not enough to just write it down. What you want to do, in addition to saying what I would want, is identify who your advocate would be, who the representative is, okay? But the formal name, whether it's this document or the other one I'm gonna go over, is called patient advocate. And again, that's what I started off with. Choose that person wisely. The other thing I wanna really caution against for these healthcare, and again, I'm talking about healthcare stuff here. We can talk about finances if we have time later. But you really should choose one person. There are some documents that allow you to choose two, like co-people. Can you imagine why that might be a problem? Yeah, yes. Especially, and this happens, I'm surprised how often this happens, where the parent knows their kids are very different, and they think somehow by pointing the two people together with different opinions, they're gonna compromise, right? So we know what happens in this situation. People dig deeper and no decision can be made. And in those situations, it is tragic to me that people had the opportunity, but we end up having to go for guardianship on some of those. So you have two family members who are equally invested and love their parents, just in a different way, different opinions, but because they can't come up with a solution between the two of them, the court has to intervene. So what makes sense is to choose the person, one person, and then there's a successor, right? So, and you hope that the person you identify first, that patient advocate, is gonna still work with the other people and take everything they say into account. And that's why there are hospital social workers. We have family meetings, and we try our best to come get everybody together, and we say, we see there's a different way of how folks wanna handle this, but this is the situation. We have to make a choice on what we're gonna do next. How can we do what your mom would want or your dad would want? And often we're able to come to something. But again, when there's two advocates, joint advocates, that don't see eye to eye, it is a problem. So what this document does, you basically identify the advocate, but then they have to accept it, okay? And so this form is the acceptance that allows them then to act, and that has to be dated in accordance, with the 5 wishes. Yes?
Does that form have a name?
So the question is, does this form have a name? And this one says acceptance by healthcare agent. So what you do in the 5 wishes document, the first thing you do is that you identify the person who would be your advocate, essentially. But they also have to sign it in order for the whole situation to be valid. Okay?
Are those forms part of the 5 wishes that you get, or for Michigan, you have to get that form from somebody else?
So the question is, can you get this, where do you get this form essentially for Michigan? Because there were a couple states that don't really respect or accept this particular document. You can get it online at the 5 wishes. I think it might even be 5wishes.org. I should have written that. Yeah, I think it's .org. And what you do is you create an account, and it is free. I think they have some paid options on their website if you want some consultation or you want to talk to a professional. Or you just need some other advice. I mean, if you have assets at all, and I say assets over $10,000 or a property, honestly, it is always a good idea to think about contacting an elder care attorney just to kind of help you figure out some things. As a hospital social worker, a lot of people are surprised that Medicare doesn't pay for long-term care or long-term nursing care in the home, right? So elder care attorneys will help you look at what your assets are, maybe double check that you're aware, for example, if you're a veteran, that there's certain benefits available. So having that extra person involved is never a bad idea. And just while we're at it, I want to make sure I give us time for questions too. What I've been talking about again are healthcare kinds of conversations. If you get your witnesses and you do your document, one of the other parts of this, as well as the next one I'm going to talk about, you have to have witnesses. So when you identify who your advocates are, you need a witness. The witnesses, there's a whole page on this, and I'll set this in the back if anyone wants to look at it. But anytime you're doing a patient advocate form, or your advance directives, your power of attorney is another way we call it, and I'm going to go over that. Your witnesses cannot be hospital employees. They cannot be family members. They cannot be the people who are going to be your advocate. The witnesses have to be neutral people, like neighbors, your church family. And at the hospital, when we do these at the hospital, what we do is we find hospital visitors, so it's really awkward, right? And it's awkward for the social workers who have to find people to sign as a witness. It's awkward for the patient who's sick, who doesn't really, feel like having a bunch of, strangers in their room. And it's awkward for the person who's being asked to do this. At the same time, because everybody, it's surprising, that we find a lot of people who are very happy to do it, but it's just awkward. So again, do the stuff before you're in the hospital, before the crisis happens. So that's one way to get your healthcare advocate done. The other way, and I think, Gail, you're gonna maybe be available to maybe have a list or something. This is the University of Michigan, what we call the Advanced Directive and Durable Power of Attorney for Healthcare form. This is available online as well to just download. There's also one through Michigan, the State Bar. St. Joe's Trinity Health System now has their own document. The VA has their own document. So there's no shortage of being able to find free forms to be able to identify a patient advocate. This one is very similar to the 5 wishes that University of Michigan has done. It is 18 pages, okay? But you really only need the middle section complete. The rest of it is the types of questions that the 5 wishes ask you, right? Like, what would you want? Do you have a religious preference? What kind of invasive care would you want? Would you want a ventilator? Would you want a feeding tube? Would you want, IV antibiotics? What kinds of stuff like that would you be open to? And again, organ donation in this one is included. And there's also a very particular line about mental health care. So Michigan has a Michigan mental health code that is, every state kind of has this, but just because you do a healthcare power of attorney doesn't mean that your loved ones can consent for mental health care and psychiatric intervention. So this University of Michigan form actually has a very special line for that. You can add that to your 5 wishes form, but it's not, I don't believe it's highlighted out separately in that document. And the main thing about getting your witnesses is that the witnesses have to sign when you sign. So if the dates are different, the document is invalid. So I am not a lawyer, okay? But I will tell you, again, we get this and people are like, here's my power of attorney, yay, I got this done, and this is who I want, and it's all witness and it's great, and we find out that one witness is today and one that matches the date that the patient witnessed and signed their document, and then another one is 2 weeks later. Those dates have to match up. However, the acceptance of the patient advocate can be a different date, okay? So the Part D on this particular form on Michigan, and again, I will have these in the back, that can be any time before you act. Now, within reason. We have had a couple times where people have contested like a family member, for example, will say, well, I can't believe my mom picked her neighbor to be the advocate. Like, what was she thinking? That person isn't able to act right now. Maybe they've had their own health issues. And because they didn't sign the acceptance, and maybe it's been 10 years or more, we can sometimes use that to say, and in those situations, we call our legal department and say, what should we do? This person really can't act. But again, if the person's already impaired and we want to use this document, the option is a guardianship. So this is tricky, unless a person, just wants to start over. Which is a really good thing I want to say is that when you do these power of attorneys, 5 wishes or the University of Michigan, for example, advanced directive form, you can revoke these anytime, provided you still have capacity. And that can be a subjective term, right? So when people get in the hospital with an emergent situation, sometimes their thinking isn't going well. Maybe they've had some medications. Maybe they've been sleep deprived. Maybe they have a urinary tract infection. Has anyone heard of the term delirium before? Yeah. So delirium by nature should be temporary. And so we don't like to activate power of attorneys when we think a patient is delirious. These should only be formally activated, okay, once you are incapacitated. And that requires 2 physicians to say you no longer can make your own decisions, informed decisions. But if you're delirious, at least at U of M, we will say, hold up, let's have shared decision-making with the family for now, and delay formally activating this document. Because once you activate this document, okay, so just having it done is just insurance. But if you need it, and you need those advocates to act on your behalf formally, like consistently and forever after it's signed, it's really hard for some providers to not want to follow that. However, by nature, a durable power of attorney should be fluid, right? So you should only go to that person when you are worried that they're not able to make informed decisions. I'll ask you next, but there's a question back there. Okay, go ahead, sir, right here in the front row.
If you signed this 10, 15 years ago, has there been changes in the regs, change in healthcare processes or from hospitals locally that says it's probably invalid or needs to be updated?
So the question is, if you did this 15 years ago, is it still valid, essentially? It is, although what we, just to kind of reduce any questions about anything, we would suggest maybe writing a little updated letter dated today that says, I reviewed this document and this is still my wishes. Some durable power of attorneys, especially if they've been done by attorneys, will even have a line sometimes on the last page where you should just review it and say, these are still my wishes. Because, medical care has changed a lot too. When I started in 1995, we at hospitals, we were very, very eager to put PEG tubes in any patient we encountered, thinking this would prolong life. Feeding tubes now are less recommended. We know that people can still aspirate when those are inserted. We know that for people with dementia and cognitive disorders especially, that they really do not prolong life in almost every situation. So there's something called Choosing Wisely. It's a website. If you haven't heard of this, it's a really great website to look if you just put Choosing Wisely. And this was put out from the American Gerontological Society, and they have positions on a lot of different health issues. And one of them in particular is when it comes to dementia. Sadly, as dementia progresses, people don't eat as much. And I can tell you, having been a part of many, many, many conversations, end-of-life conversations with people with cognitive issues, we see this as a natural part of the dying process, right? If you have cancer, we know that's a terminal condition. As it moves along, dementia is also a terminal condition. It's a horrible condition. But the society that helps families through that has taken a formal position that we don't recommend feeding tubes at the end of life. There's always a few outlier cases where we might consider, but let's see, I'm trying to remember where I got on that. But just essentially updating your document to be consistent with current medical recommendations is valuable. Yeah. You had a question back there, maybe? Okay, great, thank you. Any other questions about anything I've talked about so far? Okay. So the other thing that is relatively new to Michigan, this came out and was signed in 2023, is something called the MI Post, P-O-S-T. Has anyone heard of this? Okay. How many of you have heard of DNR documents that you should put on your refrigerator? Okay, a couple of you. Okay. So several states, years ago, Michigan is really late to the game on this, but several states got the post situation going a long time ago. So what it stands for is Michigan Physician Orders for Scope of Treatment. By the title, it doesn't tell me much, right? Essentially, though, it's a doctor's order, okay? And I brought a couple of these as well, and so I'll give these to Gail if anyone wants copies. This is essentially a document that is very important if being in charge of your code status is important to you. So there are some people, maybe in this room, who under no circumstance would want CPR, ever. Without this document on your refrigerator when the ambulance people come, if they come to your house and you're in need of CPR, they're going to do it. So it wasn't until 2023 that Michigan approved this, the legislation agreed to this document. The orders are A, CPR, cardiopulmonary resuscitation. This means a person has no pulse and is not breathing, and if the ambulance folks get to your house and they see this, they will perform this and they will take you to the hospital. Unless you've checked this box, then they will not do that. Some of the other ones, the B section here is that medical intervention. So the person has pulse and or is breathing, but they're very sick. Excuse me. And you have the option to choose things like you want comfort-focused treatment, or you want full treatment, and you can check this box. And in these situations, if an ambulance comes to your house, they will take you to the hospital, but they'll kind of be, depending on what you've written here, they'll take this document with you and them to the hospital. Hopefully, if you have completed this, you've also given a copy to your PCP, so it's already in your record at whatever health system you're most likely to go to. And you probably know that if you were to be sick, emergently, the ambulance is supposed to take you to the nearest hospital. So depending on where you live, you might know where that is. However, if that hospital is at capacity, you could go to the next closest hospital. So if you are a person in this area, I'm guessing most of you are if you're coming to church here, you may want to try to make sure that both Trinity and Michigan Medicine have a copy of this on your record if you see anybody in those systems.
What is your PCP?
Oh, sorry. What is PCP? Primary care physician. Yep, great question. Yep, and they should hopefully have that in your record. The other part of this post is just like the other documents. There's some lines for some narrative. You can add some specific suggestions or things you would or would not want. And then here's the big part. This document must be signed by your PCP, by your primary care doctor. It has to be. And when they do that, This becomes an actual medical order. But if no one sees it, it doesn't exist. It's just like these power of attorneys. When you do them, get it in your record. Give a copy to your advocate. It's amazing how many times, again, in an emergency situation, someone's in the hospital and says, oh, I did that, but I don't know where it is. Well, it's important that your advocate has a copy, because then they can come and show this and say, hey, I'm Joan's durable power of attorney. I'm her advocate. I want to make sure this is how you treat her while she's here. Or if there's any difficult decisions that need to be made, call me, and I will help you with that. But this POLST document, or POST here, it's POLST in other states, P-O-L-S-T. In Michigan, it's P-O-S-T. But this is an order. And again, a lot of ambulance drivers are trained to look on cabinets or refrigerators for these documents that include things like, DNR or post orders now. List of meds is another great thing. While you're at it, keep an updated list of your medications in that same Ziploc bag on your refrigerator, because when you get to the hospital, they want to know what you're on, what you're taking, right? So it could be very important if you're on things like blood thinners or diabetes medications, water, Lasix, which is a diuretic. Those things are very important. And so you want that continuity when you get to the hospital. You also, if you miss those things or you've overtaken some of those, again, it gives us a really good place to try to problem solve. If you come to the hospital really altered, it gives us a really good idea of where to start, what were the high risk meds that you were taking. The other thing about this POLST forms is that if you have done a power of attorney, if you've done this or you've done the 5 wishes, theoretically they should also sign this document, okay? Because they want to know that everyone's on the same page. Because again, if you're incapacitated and nonverbal and unable to interact with us, we don't know if your power of attorney knew what you wanted. So you should sign it, they should sign it, and your doctor should sign it. So it's a full care team situation. If nothing else, their phone number should be on this so they know who to call. The other thing is similar to this power of attorney, what I told you all. Don't be afraid to do these. You can change your mind, right? You can change your mind about what you want. You can change your mind about who you want. You can revoke the whole thing. We have a lot of people, interestingly enough, a lot of healthcare providers and legal people, and social workers and nurses who don't have these. I'm always shaking my head. But a lot of times we had a judge I can think about that was in the hospital, and he just said, I just saw so much fighting, I'm just going to leave it to chance and see what happens. I don't want anyone in charge of me. And I was like, but you know what happens? You're going to get this third-party guardian who doesn't know me. And he's like, you know what? In my circle, I'm going to take my chances. I'm like, okay, fair enough. I get it. Families can be complex. So, yeah, go ahead. Yeah, so the Kelly's asking about suggestions on how to have these conversations. I think that the first thing is to identify up front and say, I know this might be hard to hear. So my mother-in-law, I'm very fortunate to have a lovely, lovely in-law family, and but she's been giving away things already. Like she's starting to identify family things and telling us the stories about them. And, we're not expecting her to leave us anytime soon with, God willing, but she is just taking the initiative on that. So that's, again, one of the things is to identify that this could be hard, and especially if you have emotional people in your family who are like, I'm not talking about that. It's very common that people will start to say, hey, I wanted to talk about where my things are if something happens to me, or if, this is where I want to be buried, and your adult family, children might be like, I'm not talking about that right now. But I do think it's important to start the conversation and preface it with, I know this could be hard to hear, but I have some really important things I want to share with you. And you can figure out in your family, because every family is different, there's no one prescription for this, is when is that best? Is this best one-on-one with your kids? Is this best as a family meeting? Is this best, at a holiday time as you're sharing traditions? And like my mother-in-law is giving away things. It's like, this was something that was given to me. The main thing, though, is to start the conversation and to try to sort out in your family what process makes sense. There are, professionals, for example, getting an elder care attorney visit. This is one of the times that can spark the conversation. These are our assets. These are what we would want done. This is who we would want to do things. If your family doesn't want to have these conversations, and sometimes that happens, sometimes they are really resistant because they're afraid of losing you. They're the anticipatory grief that's happening, and anxiety can be really tricky. That is especially when you might think about getting some help for yourself through a counselor, and trying to sort out how to navigate that with your family. This is especially difficult when there are some fragmented relationships, and maybe all the adult children don't get along, or there's very different opinions on what should happen. So in my family, for example, I think with my mom, who passed away several years ago, she was so clear about what she wanted. There was no issues. My dad and my brother are really tight. And I know what my dad wants, and I know my brother is just gonna struggle. He is just not gonna wanna do what my dad wants. And I'm the advocate, right? So I know this is gonna be really challenging. But my dad, I'm trying to get him on board with reminding my brother as he's able, things like, I've had a great life, and I feel very fortunate to have had so many blessings. But if I'm unable to do these things for myself, I really want to be comfort focused. So I keep reminding my dad, just drop the hints. What is hard is, even because these are difficult conversations, again, the title of our thing, is figuring out for your family how to navigate that. And, setting aside some time, though, getting the documents done, and talking about the documents. Yes, go ahead.
You mentioned several times an elder care attorney.
Mm-hmm.
How do you go about, do people advertise that they are an elder care attorney?
Yeah, so the question is, how do you find an elder care attorney? So elder care attorneys are they're gonna focus on the business aspect of winding down, so to speak, and if something were to happen, how do you navigate that? Money is an important factor in a lot of people, and it actually causes the most conflict in a lot of what we do. So even at the hospital, when it comes to, again, a lot of our clients who have cognitive issues, who really hope to stay home, and we, as a social worker, I want to support that too. We as a healthcare system in our country, we want to do the least restrictive interventions and really promote personhood and allow people autonomy to make the choices they want and to be where they want. Okay, I want that. However, when people are unsafe okay? A lot of falls, people are mismanaging their medications. It's winter in Michigan, people wander outside and get locked out. There's certain things that are deal breakers for being able, for a hospital to feel good about people returning home alone, okay? And so when we have those conversations, again, this is when we find out that a lot of people are surprised that your Medicare doesn't cover that extra support. Your Blue Cross doesn't pay an aide to come and check on you every day, especially if you need 24-hour care. Home care agencies right now, anyone know how much those cost? Private duty, the average rate right now in Washtenaw County is $35 an hour, okay? So if I need 24-hour care, I better have a lot of money, and I better be willing to spend that money for that. A big source of conflict with adult children and families is spending that money. Sometimes it's very legitimate in terms of them worry, mom's gonna run out of money. They don't disagree she needs the help. They just think, maybe let's just piece together a little bit and take our chances, okay? And sometimes that's okay. But sometimes, if we're worried about fire risks, or again, that wandering is a really big one for me personally, because I've seen a lot of hypothermia and even deaths as a result of people getting outside for too long. I have a really low threshold as a discharge planner if I think someone could get outside in this weather. So that is another really big source and a very difficult conversation to have, and again, this is where the person, while they're able, should tell their kids, you know what, I have this money, I have X amount of money. It's okay if you spend it on this in-home care. Or I've had the people who are able to say, you know what, I would rather risk freezing to death than going to a nursing home. And they write that down in this document, right? Then what, as a hospital, we can value that a little bit more because, the lawyers out there, and I'm married to one, we just feel like we have a little bit more freedom, that we're respecting people's wishes, and they document it, and this is what they want. This would not be my choice to freeze to death, but hey, they put this in this document, and we try, we might have a little bit more flexibility. Ultimately, if it's really, really bad, we don't, we have to have that chat.
It could be that the person has not written it down, their wishes, but they've said, promise me that you never put me in a home.
Oh, yes, Gail. If I had a penny for every time someone has told me. So what Gail's saying is what happens, it's maybe not even written, but the adult, the person has told their kids, promise me you'll never put me in a place, promise me you'll take care of me. And this is the difficult conversations I have with patients, and in my counseling business especially, where we have a lot of this, because families are more, it's not uncommon for family members to live far away, so they themselves aren't able to be the ones to come by and check, or they are, again, it is not financially feasible for a lot of people to hire 24-hour care at $35 an hour. And the free services that are available are very limited. And it's gotten worse over time. When I was first a social worker through the Area Agency on Aging, which is now called Ageways, we could get 40 hours a week pretty easily if people needed ADL assistance, okay? That's the daily living of activity. So things like showering, bathing, toileting, needing help with meds. We could get 40 hours. 40 hours is beautiful, because what does that allow? That allows most families to have the adult child or the friends or the support network still work, right? But still then be able to come home after night or have their loved one live with them, and still 40 hours is a lot of care. Right now, we are lucky if we can get 15 hours a week. If you're on Medicaid, these are low-income folks that really cannot afford anything out of pocket on their own, so they're completely dependent through the state of Michigan. The Medicaid, there's a program, what's called the chore provider. We used to be able to get a maximum of 20 hours a week. Still not great, but we can't even get that. Now we're averaging 8 to 12 hours a week for those people. So if I'm a person who needs help, I'm doing well in so many ways, but I just forget my meds. And I have morning meds and nighttime meds. 12 hours a week does not allow for me to be safe at home if I don't have extra family support, okay? So the 20 hours a week came pretty close, right? If you could get 1 hour a day, that's 14 hours. 8 to 12 hours doesn't permit for that. So, you know, I'm a big advocate. I sit on some committees on the state, the Attorney General's office. I'm on a committee called the Elder Abuse and Neglect Committee, because self-neglect is one of those things that we see, not intentionally are people trying to neglect their needs, but they just don't have the resources to have what they need to be safe. And that's considered neglect, you know, when they're coming back and forth to the hospital. We see these situations, we know what they need. We just can't find the resources to make them have what they need to be safe. But to get back to your point, those are those difficult conversations, right? And that's for adult children too, to say back to mom or dad, you know what? I am gonna do my best to help you be at home and age in place there. However, I don't wanna promise you something I can't do. And that's hard. It's a very hard conversation. And again, most of the times these happen at hospitals when the crisis has happened. And so we're encouraging people, you know, and I'm glad you all are having this chat today, even though it's difficult, you know, to try to bring up, hey, I'm worried, Mom, I know you don't want to do this, but I'm not going to be able to quit work. I can't afford to not work. So if you need around-the-clock care, you know, we got to figure out something else. Okay, so I'm going to leave room. I know. Yep. Oh, go ahead.
Just two things real quick. One is, thank you so much for all the
Yep.
information. I've worked as a chaplain too, and it's executed a lot of those.
Oh, good. Yes, I bet.
And so two things. One, it's super helpful, even if you have the paperwork complete, to normalize that in family conversations. So if you have one from 5 years ago, you know, just next time, just it doesn't need to be a big 3-hour thing, but just say like, just for clarity, so-and-so is still the decision maker, just because people forget. And so just normalize that as part of, we all do this, and I have one, you know.
Yeah, and you should get one too.
Right. And then the second part is, I see a big gap sometimes. We do some good information about advanced care planning, and people go home with forms, and they sit there, and nothing's ever done with them. Or if they're filled out, then they're not submitted with the hospital, that, you know, they're not in Epic, and the hospitals don't know about them, and then someone can't find them. And so they're like, oh, I know that so-and-so is with them. So that's an invitation that if there's not already something planned, if there's interest of anyone in this group here to have these documents completed and witnessed, that we can create something where we actually do that for each other and have a little bit of like a signing party or something if people have clarity or want to do that. So not selling that at all, but that's something that we can do as a community.
That's such a great suggestion, and I don't know if all that was on tape, but the suggestion was it can be hard, you know, you get the document, but you don't actually do anything with it, and a big barrier to getting them completed correctly is to get the witnesses. So maybe as, you know, a community, you all think about a signing party. There's actually something, this sounds macabre, I know, called a death cafe, where they have these events around the communities where people get together and do their power of attorneys and talk about it and say, wow, my son doesn't want to talk about this with me, and they all give each other suggestions. But yeah, it's a very important thing for everyone over 18 to get these documents done. Any other, I will stay here. I know I've gone over because there was a lot to cover. These are really important. The last parting words I would give you with my U of M social worker hat on is that discharge planning starts the day you get in the hospital. And hospitals don't always keep people as long as you think they should. And so subacute rehab facilities, which means rehabilitation in a nursing home. I'm not going to sugarcoat it. It is in a nursing home setting, but they have special wings where they do rehab. This is becoming a very common part of your medical care. And so I encourage all of you, whether it's a planned surgery like a hip surgery or a crisis that could happen, to look around the community and be familiar with the resources that are here for yourself in case there was an emergency, where you would be willing to go. Sometimes it's dependent on your insurance, where the contract is with, especially if you have an Advantage plan. But yeah, just keep in mind you want to be informed consumers on all of this, because healthcare system is changing. Hospitals really are there now to really treat the acute problem, but also use the resources like the social workers in the hospitals if you find yourself there and want some support. Thank you for having me. I'm going to stay here and answer any other questions, but thank you.